So we're going to talk a bit about the day of surgery. What can you expect? So the first thing is that our nursing staff will escort you to our operating room area. This is a separate part of the office that's totally private and closed off. So you'll be the patient of the day during this procedure. The second step is that the nurses will take your vital signs. This is blood pressure, for example, and oxygen saturation. Will be monitoring you throughout the procedure. And they'll also get you ready, put a gown on you, and get you ready to begin the process. Third step, I will take pictures of you. These are the pre-operative photos, often from different angles. And then I will make marks on you. And these are just landmarks that might guide, what parts of the face are we looking at, what parts of the body, to help guide our surgery. So the next step is the nurses will get you ready by applying Betadine. This is a liquid that will actually sterilize the surface of the skin. And then you will go onto the operating table. Oftentimes we will have a heating pad which circulates warm water because we want to make sure you stay comfortable throughout the procedure. So step 5, you'll be given a sedative. This is usually a Valium type medication. And then we also will be monitoring throughout the procedure your blood pressure and your oxygen saturation. Then I will add the local anesthetic. This usually feels like kind of a gentle pressure, and it's very effective at completely numbing the area that we will be working on. So when we are done, the nurses will clean off the surface, and whether it's the face or the body, and then we'll apply a dressing or a compress, and most of these provide some degree of compression and are left on for overnight until we see you the next day. So another thing to keep in mind is the duration of a surgery. So most surgeries will take 2 to 5 hours, and if you're uncomfortable or if you have to use the restroom at any point, just let us know, because we're using local anesthesia, you are able just to go to the bathroom and then come back and we can resume. And then the final consideration is after you get home, you're just going to relax and leave on those compression garments. I will call you on my cell phone that evening just to see how you're doing, to answer any more questions. If you need to, you can call me right back on that number. And then we'll see you the following day in most cases.